A clinical question needs to be directly relevant to patient or problem at hand and expressed clearly that enable you to facilitate the literature search for an answer. This tutorial guides you through the steps to identify information needs, locate relevant resources for background reading, and to develop a focused clinical question within the PICO framework that is directly relevant to a real clinical case scenario. Let us define PICO. P stands for patients, populations, and problems. How would you describe a group of patients similar to yours? What are the most important characteristics of the patients? I stand for intervention, exposure, prognostic factor. What main intervention, like therapeutic, diagnostic, prognostic, or exposure, are you considering? What do you want to do with this patient? C stands for comparison. What is the main alternative being considered, if any? O stands for outcome. What are you trying to accomplish, measure, improve, or affect? The first step of evidence-based medicine is to identify information needs. For this tutorial, I will begin with Haley Beaver's personal health story. Haley is a 25-year-old model and the wife of Justin Bieber, who earlier this year suffered a mini stroke. In March of this year, she recorded and shared her story in a 13-minute YouTube video to educate her followers about the risk of stroke in young adults and the closure of her PFO. You can listen to her story on the YouTube channel. As a medical trainee, background research is very important. The background knowledge you gain can help you to develop a focused research questions. For Haley's case, example of background questions include: what is PFO? How common is PFO in adults, and how PFO is diagnosed? How common are mini strokes in young adults? Resources that provide background information include book chapters that you can find in Clinical Key, Access Medicine, LWW Health Library, or UC Library Search. In addition to that, you also can find it in clinical decision support tools that are listed on this slide, like BMJ's Best Practice, Clinical Key, Dynamac, JAMA Evidence, and UpToDate. You can access all of these resources from the Groningen Medical Library core resource page. Here is the example of a search from Access Medicine for PFO diagnosis. The results return with a large number of book chapters, quick reference resources, as well as cases and images. Searching Clinical Key for PFO, the results came back with hundreds of journal articles, book chapters, images, and videos as well. Dynamac is one of the point-of-care databases UCI subscribes. Similar to UpToDate, you can find recent and evidence-based background information here. Before you begin a PubMed search, think of a clinical question within a PICO framework. The terms derived from PICO will help you to define key terms for literature search and the type of articles you want to evaluate and find the answer to help with clinical decision making. Based on Haley's mini stroke episode, we developed a focused clinical questions that can be addressed in two different ways. The first way is to structure the question based on a single patient. In a 25-year-old female with regular migraines and first ever TIA, with the closure of patent for foramen oval reduced the number of migraines, risk of blood clot, and incidence of TIA compared with drug treatments. The second way to structure the question is to change a single patient to a group of patients, like in young adult female, less than 45 years old, with regular migraines, attack, and first ever TIA, and then the rest of the question remained the same. Here's the PICO breakdown. As you can see, the PICO framework helps clarify the clinical questions. Each breakdown elements helps to define the search concepts and to identify important key terms for the PubMed search. The word highlights in red are key terms that we will use to conduct the PubMed search and for screening flu from the final search results. Based on the level of evidence in clinical research, RCT and cohort are the preferable studies you want to find in primary research for a treatment prevention questions. End of video.